When you think about the future of your career, where do you see yourself? Have you ever considered working in corrections? There are psychologists, therapists, counselors, social workers, and other mental health professionals who go to work every day in jails, prisons, and detention facilities, and would not dream of doing anything else.
Yeah, I always joke, you either work in corrections for 2 weeks or 20 years, because if it's in your blood, it's just in your blood, and you realize, like, I can't do this work anywhere else and have the impact I have here.
Being able to really see the impact of the interventions that you're giving in real time is something I find very unique about corrections versus being in the community, where you're not seeing these individuals on such a routine basis like you are in the prison or jail setting.
We in corrections have access to folks with such diverse needs, right? From minor struggles with anxiety or depression to major mental health needs like schizophrenia and bipolar disorder, and everything in between.
Well, in a correctional environment, the normal presentation is people who have deficits in social skills, education, serious substance abuse problem, all kinds of social support, inadequate coping skills. These people are often bringing really serious problems, but they're still people. And I feel like a lot of people on the outside, it's hard for them to understand that.
Although my patients have been through so much trauma, psychosocial stressors, racism, financial hardship, loss, they still come to our conversations as kids, and they are hopeful and upbeat and thinking about the future often.
It's very comparable in that you're using a lot of the same techniques. You're going to be using cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing. We even use EMDR, depending on what the patient's needs are. You're going to be developing an individual treatment plan the same way you would in the community based on your patient's needs, and providing those counseling sessions and therapeutic interventions in the same structure, just in a very different setting.
One of the maybe more surprising things is there's that, especially in the male community, it's you don't reach out for help. You bottle it and you figure it out, you push through, right? And so it's been really cool to see a lot of guys reach out for help. And so I'll meet with one guy in Alpha unit, and then all of a sudden I'll have 3 messages on my computer from 3 other guys in that unit because they went back and they're like, hey man, go meet with this guy, he can help you out.
If you want to be where the need is greatest, this is where it is. There's no place that you will find people in greater need.
It really is a job that you have to feel passionately about, personally and have that drive and that motivation to do it.
There are a lot of young people who want to make a difference and try to tackle the system with me, which is really exciting.
Discover the rewards of a career in correctional mental health. For more information, contact the National Commission on Correctional Healthcare, ncchc.org.